What is the best way to prevent repetitive movement injuries? What is a repetitive strain injury? A repetitive strain injury, RSI, is an injury caused by repetitive motion and overuse. This can damage muscles, nerves and tendons, causing discomfort and pain. RSIs are also known as repetitive motion injuries, RMIs, or repetitive motion disorders, RMDs. There are many causes of RSIs, but they often occur when people perform the same motions over and over again. This can happen at work, during leisure activities or even while sleeping. RSIs can also be caused by poor posture or ergonomics. Symptoms of RSIs vary depending on the type and severity of the injury, but may include pain, numbness, tingling, weakness and/or cramping. If you think you may have an RSI, it's important to see a doctor or other healthcare provider for diagnosis and treatment. What are the symptoms of RSI? There are a number of symptoms associated with RSI, including pain and/or numbness in the affected area, weakness in the muscles, and difficulty moving the affected limb. In some cases, people with RSI may also experience tingling or burning sensations. In severe cases, RSI can lead to paralysis. 12 key tips to reduce the risk of RSI. There are a few key things you can do to help reduce your risk of developing RSI. 1. Use ergonomic furniture and equipment. Ergonomic furniture and equipment can help you work more efficiently and comfortably. By using ergonomic furniture, you can reduce the risk of developing musculoskeletal disorders. Ergonomic furniture is designed to fit your body and minimize the strain on your muscles and joints. Equipment such as keyboards, mice, and monitors should be positioned so that they are easy to use and do not cause discomfort. 2. Take breaks often. If you are typing or using the mouse for long periods of time, take a few minutes every so often to stretch and move around. This will help reduce the risk of developing repetitive strain injuries. 3. Improve your posture. Poor posture can cause RSI, so make sure you sit up straight and keep your wrists in a neutral position when typing or using the mouse. 4. Avoid repetitive motions. If you find yourself doing the same motion over and over again, take a break and stretch to avoid injuring yourself. 5. Avoid awkward positions and maintain good posture. Avoid sitting for long periods of time. Get up and move around every 20 minutes or so. Don't sit on your wallet, cross your legs, or wear shoes that don't support your feet. Use a lumbar support when you sit. This can be a small pillow placed in the small of your back or an adjustable backrest that you can attach to your chair. When standing, keep one foot slightly in front of the other and maintain good posture by keeping your shoulders back and down, and your stomach pulled in. Don't stand with one hip higher than the other as this can cause lower back pain. If you have to stand for long periods of time, put one foot on a stool or box to take some weight off of it. Also, don't wear high heels as they can cause lower back pain by throwing off your posture. Instead, wear shoes with low heels that provide good arch support for your feet. 6. Use proper lifting techniques. When lifting an object, always use proper lifting techniques. This means keeping your back straight and avoiding any sudden or jerky movements. Use your legs to lift the object, rather than your back, and try to keep the object close to your body. If the object is too heavy to lift safely, ask for help. 7. Exercise regularly to maintain strength and flexibility. Exercise is a great way to stay in shape and improve your overall health. It can also help you maintain your strength and flexibility as you age. Try to get at least 30 minutes of moderate intensity aerobic activity, such as walking, biking, or swimming, most days of the week. In addition, aim to do strength training exercises, such as lifting weights or using resistance bands, at least 2 days a week. 8. Eat a healthy diet to support your musculoskeletal system. A healthy diet is important for supporting your musculoskeletal system. Eating a diet that is rich in nutrients and minerals helps to keep your bones and muscles strong. Additionally, eating a healthy diet can help to reduce inflammation throughout your body, which can help to reduce pain and stiffness in your joints. 9. Drink plenty of water to stay hydrated. Water is essential for our bodies to function properly. Every cell, tissue, and organ in our body needs water to work properly. Drinking plenty of water helps to keep our bodies hydrated and functioning at their best. 10. Wear comfortable, supportive shoes. Wearing comfortable and supportive shoes is important for your feet and overall health. Shoes that are too tight or have high heels can cause problems with your feet, including bunions, calluses, and blisters. Wearing the wrong shoes can also lead to back pain and other problems. 11. Manage stress levels to avoid tension in the body. Stress can have a negative impact on our physical and mental health if it is not managed effectively. When we are stressed, our bodies go into fight or flight mode, which can lead to tension in the body. This tension can cause headaches, muscle aches, and other physical symptoms. To avoid these problems, it is important to learn how to manage stress levels. There are many different techniques that can help, such as relaxation exercises, journaling, and spending time in nature. Experiment with different methods to find what works best for you. 12. Stretch regularly. Stretching helps keep your muscles flexible, which can help prevent injuries. Stretching regularly can help keep your muscles flexible and prevent injuries. When stretching, be sure to warm up first and to stretch slowly and gently. Hold each stretch for 10 to 30 seconds. How is RSI diagnosed? RSI is diagnosed when you experience discomfort or pain in your muscles, tendons, and joints from repetitive movements. Ergonomic factors, such as range of motion and improper body mechanics, can contribute to RSI. And inflammation or irritation of the nerves may also be present. Your doctor will refer you to a physical therapist or surgeon for further evaluation and treatment. How common are repetitive strain injuries? Repetitive strain injuries, RSIs, are a type of injury that can occur when you overuse a particular muscle or group of muscles. RSIs are relatively common, especially among people who work in jobs that involve repetitive motions. Some of the most common RSIs include carpal tunnel syndrome, tendinitis, and epicondylitis. Who gets repetitive strain injuries? Repetitive strain injuries, RSIs, are a type of injury that can occur from doing the same motion over and over again. They can happen to anyone who does a lot of repetitive motions, but they are most common in people who work with their hands, such as carpenters, painters, bartenders, kitchen staff, and office workers. RSIs can also occur from using tools that vibrate, such as power drills and sanders. How is repetitive strain injury treated? There is no one-size-fits-all answer to the question of how best to treat repetitive strain injuries, RSIs. The approach that will work best for a given individual will depend on the specific type of RSI they are dealing with, as well as the severity of their condition. In general, however, treatment for RSIs typically involves some combination of rest, ice, heat, stretching, and strengthening exercises. In more severe cases, medications or even surgery may be necessary. If you are suffering from an RSI, it is important to consult with a healthcare professional to develop a treatment plan that is right for you. Tips for preventing RSI. One of the best tips for preventing RSI is to improve your posture. This means sitting up straight with your shoulders back and your wrists in a neutral position. You should also take frequent breaks to stretch and move your hands and wrists. Avoid unnecessary repetitive motions and exercises that put strain on your muscles. If you do experience pain, take a break and ice the affected area. Improving your posture, taking breaks, and exercising regularly can help prevent RSI and other repetitive stress injuries. In conclusion, a repetitive strain injury, RSI, is a type of injury caused by overuse and repetitive motion. Pain, numbness, tingling, weakness, and/or cramping are all symptoms of RSIs. Poor posture, as well as poor furniture and equipment, can contribute to them. Sitting on your wallet, crossing your legs, or wearing shoes that do not support your feet are all bad ideas. Maintaining strength and flexibility requires regular exercise. To support your musculoskeletal system, eat a healthy diet. Lifting heavy objects safely requires the use of proper lifting techniques. Keep your body hydrated and functioning at its best by drinking plenty of water. Stretching on a regular basis can keep your muscles flexible and help you avoid injuries. To avoid tension in the body, which can cause headaches, aches, and other physical symptoms, manage stress levels. Repetitive strain injuries, RSIs, are a type of injury that can result from repeatedly performing the same motion. RSI and other repetitive stress injuries can be avoided by improving posture, taking breaks, and exercising regularly. I hope you learned something new today. Take care and stay healthy.